What is blepharitis? Blepharitis is inflammation of the eyelids, usually affecting both eyes at the same time. You don't have to worry about it being contagious though, it's not. Blepharitis is a common condition, affecting about 15% to 25% of people. Overall, it affects both men and women, but one type, staphylococcal blepharitis, affects many more women than men. Despite being common, blepharitis is often not treated correctly because there are many issues that could cause the same symptoms. Types of blepharitis. When the outside front edge of your eyelid is inflamed, this is called anterior blepharitis. When it's the inner edge of your eyelid, the part that touches your eyeball, this is posterior blepharitis. It's possible to have both at the same time. These types of blepharitis can be Demodex blepharitis. This condition is caused by tiny mites on your eyelash follicles that can cause inflammation. It can cause chronic redness and itchiness. Staphylococcal blepharitis can cause you to have missing eyelashes, or they don't stay straight. Seborrheic blepharitis can cause greasy flakes on your eyelids, like dandruff. Ulcerative blepharitis can cause crusts on your eyelids that bleed if you remove them. Meibomian blepharitis can affect the quality of your tears. Blepharitis symptoms. If you have blepharitis, it's likely on both eyelids. Common symptoms are feeling like there's something in your eyes, frequent blinking, dry eyes, watering eyes, burning or stinging in your eyes, redness along the edges of the eyelids, swollen eyelids, flaky skin around your eyes, itchiness, crusting on your eyelids or eyelids sticking when you wake up, a change in your tears. You could also have more severe symptoms such as changes in your vision, blurriness, eyelashes falling out, eyelashes that don't point straight, swelling in your cornea or other eye tissue. Blepharitis causes. Blepharitis causes usually depend on the type you have, anterior blepharitis or posterior blepharitis. One type of anterior blepharitis, staphylococcal blepharitis, is caused by bacteria. The bacteria are naturally on the skin of your face and eyelids. Sometimes, there are too many though, and this can cause blepharitis. Seborrheic blepharitis is caused by dandruff. Other less common causes of anterior blepharitis include seasonal allergies, other allergies to medications, lotions, animals, etc., mites, overusing eye makeup, poor hygiene, viruses, trauma to the eye. The most common cause of posterior blepharitis is blocked oil glands, but it can also be caused by rosacea, scalp dandruff, meibomian gland dysfunction, which happens when your oil glands don't produce enough oil and your eyes dry out. Blepharitis risk factors. Anyone can get blepharitis, but some people have a higher risk of getting it or getting it more often. These include people who have oily skin, have a lot of bacteria on the skin, keep their eye makeup on for too long or don't remove it properly, wear contact lenses, are exposed to dust and irritating chemicals, are exposed to dry environments, have allergies, have diabetes, are being treated for cancer, are experiencing hormonal changes, such as going through menopause. Is blepharitis contagious? Blepharitis may look like it can be contagious, but it's not. Blepharitis diagnosis. Your doctor will ask about your symptoms. They might also look closely at your eyelids, your eyelashes, and the texture of your skin. Use a magnifying device to look at the edges of your eyelashes, eyelids, and the openings of the glands. Check that your eyes are making enough tears. Take a sample of material from your eyelids to check for bacteria. Blepharitis self-care. There's no cure for blepharitis, but you might be able to manage and treat it by taking care of your eyelids. Warm compresses can help soften crusts and loosen oily debris. Follow these steps. Wet a clean washcloth in warm water. Wring it out and place it over your closed eyelids for 5 minutes. Wet it again as necessary to keep it warm. Keeping your eyelids clean may also ease symptoms. Make a solution with a few drops of baby shampoo and a cup of water. Dip a cotton swab or a clean cloth into the mixture. Close one eye. Gently wipe the washcloth over your eyelashes and the edge of your lids for about 30 seconds to loosen clogged oil. Apply light pressure along your eyelashes to squeeze out clogged oils from the glands behind your lashes. Rinse thoroughly with a clean, warm, wet washcloth. Pat dry. Then, do the other eye. You could also do this in the shower, by allowing the warm water to wash over your face for about a minute. Then, wipe some baby shampoo over your lids and lashes using a clean, wet washcloth, and wash it away with the shower water. There are some over-the-counter eyelid washes or lid scrubs that might help ease the symptoms. If your eyes are dry, you may want to try some OTC artificial teardrops. If possible, stop wearing contact lenses and using eye makeup while you have blepharitis to reduce irritation. If you continue to wear makeup, be sure to thoroughly remove it every night and clean your lids with a baby shampoo and water cleanse. Blepharitis treatment. Your doctor will have to determine what type of blepharitis you have and its cause. Your doctor might recommend medicated eye drops called lotilaner. These FDA-approved drops target and kill mites on your eyelashes. Artificial tears. Antibiotics, either as an ointment, drops, or a spray for your eyes, or as pills. Antiviral drugs. Plugs that block your tear ducts to keep more tears in your eyes. Other medications, such as glucocorticoids or cyclosporin. Your doctor might also recommend a nutritional supplement, such as omega-3 because it might reduce inflammation. Sometimes, blepharitis can be severe. In such cases, you may need more advanced treatments, such as microblepharexfoliation. Your doctor uses a special microsponge to exfoliate the eyelid edge. Intense pulsed light. The light is aimed at the eyelid skin and can break down blockages in the glands. Thermal pulsation. A device applied to the eyelid sends heat and pulses to the eyelid to help open up the glands. Thermal expression. A device applies heat and force to the glands to allow them to open. Regardless of the type of blepharitis you may have, it may come back repeatedly, which is why self-care and eye hygiene are important. To lessen the risk of it coming back, it's also important to take care of anything that puts you at risk for it. For example, if you have allergies, speak with your doctor about the best ways to keep them under control. Blepharitis complications. The inflammation of blepharitis can lead to complications, such as loss of eyelashes or eyelashes that grow in the wrong direction. Excess tears. Dry eyes, which might raise your chances of a cornea infection. Clogged glands that might get infected or form a lump. Scarring on your eyelids. Cornea inflammation or ulceration. Chronic conjunctivitis. Blepharitis prevention. A few lifestyle changes might help keep blepharitis away. Keep your eyelids clean. Remove all eye makeup before bed. Don't use eyeliner on the back edges of your eyelids, behind the lashes. If you're in the early stages of treating blepharitis, prevent further irritation by not using makeup. Once you start to use eye makeup again, replace products that you use on or near your eyelids. They may be contaminated. Add foods with omega-3 to your diet or take omega-3 supplements. Use artificial tears if you have dry eyes. However, if you need to use them more than a few times a day or for a long time, speak with your doctor first because OTC artificial tears aren't meant for constant use. Takeaways. Blepharitis can be annoying and distressing because of how it can make your eyes feel, but it's not contagious and it's not usually serious. While there's no cure for blepharitis, you can often ease its symptoms and avoid it with good eyelid hygiene. This includes practices such as removing eye makeup properly every night and washing your eyelids with a gentle baby shampoo and water mix. If your symptoms don't go away or they become more serious, see your doctor because you may need medication. Blepharitis FAQs. How long does blepharitis last? Acute blepharitis, caused by an infection, for example, may go away once you've taken care of the cause. Blepharitis that is chronic has no cure. The symptoms come and go, but you might help shorten the time with good eyelid hygiene and seeing your doctor if the symptoms don't go away. Does blepharitis go away on its own? The symptoms may improve, but blepharitis doesn't completely go away on its own because it's a chronic condition. Is there a cure for blepharitis? No, there is no cure for blepharitis. What is the main cause of blepharitis? The most common cause of blepharitis is bacteria. What is the best treatment for blepharitis? The best way to treat or manage blepharitis that is not severe is with good eyelid hygiene. Also, it is important to avoid eye makeup during a flare-up.